The Champions of Care video team recently visited the Center for Exceptional Families and talked with pediatric physical medicine and rehabilitation specialist, Dr. Eileen Donovan. Let's take a look.
Okay, go get Daddy. Go get him.
If there is a child with a history of being born prematurely who's not doing the milestones on time, no 2 or 3 month old holds their head up, but if you see that beyond that they're not starting to hold their head up when you're holding them in your arms, and if they're not rolling and their head is always off to one side when they're laying down, that might be a sign that cerebral palsy is something to think about. If you see children who are favoring one side and not using the other, that could be a sign of cerebral palsy. Or children who are moving in a way that your other children didn't and you think, oh, that looks kind of stiff moving. You might want to get kids started into therapy as soon as possible, because it's always easier to do the therapy the younger they are, and help establish those new movement patterns as they're going through them rather than trying to play catch up later.
2 socks.
Spasticity is high muscle tone. A lot of parents describe it as a tightness. So a child's muscles are not as loose and flexible as a typically developing child's would be. One of the first things I do is get a birth history and an early development history to see how kids have been doing, if there were any red flags early on in development. When I'm doing my physical examination, I'm looking to see if the joints move fully or if there's any tightness there, and also to get a sense of the muscle tone, how easily a muscle can be moved and how much stiffness it has in it, which can be a sign of cerebral palsy. Physical therapists and occupational therapists work to make sure that the range of motion of the joint remains loose, because a kid who's got a very tight muscle can't use it functionally without getting that range back. So ranging, showing parents how to range, and then taking the children through the normal motor patterns. You have to retrain them how to change the way they're walking so that their brain recognizes that. And now there's joints and all kinds of advancements in orthotics that help keep feet in the proper alignment to help normalize a walking pattern. And then of course there are walkers and crutches and things like that as an extra assistive devices. There are wheelchairs and strollers that didn't exist 10 years ago, and the technology for power wheelchairs for children who can't move independently by walking can move independently through their world with a power wheelchair. There are eye gaze systems where you look at part of the augmentative communication device and it will track where your eye is going. And so that has opened up a whole new world for children who used to be thought to be pretty impaired, and really there was a lot going on in there. They just had no way to get it out. And now with the augmentative communication systems and the computers that are out there now, it's just changed so much for so many kids. Kids' bodies can take a beating because of the cerebral palsy and the spasticity. Often happens with puberty. When they grow, we know that bones grow faster than their spastic muscles. So frequently, kids who are doing pretty well, when they hit that growth spurt in puberty, they tighten up, they start moving differently and less efficiently. So they often need a boost of therapy during that growth spurt to try to keep them as functional as they had been. Because I don't want a kid to be walking and then hit puberty and need a wheelchair because they couldn't keep up with their body's own growth.
Go.
When kids are little, their goals are their parents' goals for them, because they don't have the ability to talk and tell us what their goals are. And once they are old enough to participate in their own therapy, working on their functional goals and deciding what they want to do, and if a child has chosen that it's just too difficult, even though I don't want to see them go into a wheelchair, if that makes them an efficient high school student, then we need to look towards that and look at walking outside of school in another way. But usually, as soon as kids are old enough to start participating in their own health plan, they're part of the plan. What's important to them? Because I'm not going to get a child to want to wear a brace if they think the kids at school are making fun of them for wearing a brace. I can't just say that's what you need and that's it. I've got to figure out a way to get a bracing schedule that the kid will work with and will be compliant with, and if that means you wear your brace after school until bedtime, then that's what you have to do.
Now,
We're very fortunate at the Center for Exceptional Families to have a whole spectrum of services here. If a child sees me first and needs therapy services, those are available here, OT, PT, speech. We have a nutritionist who can help because a lot of children with cerebral palsy, the spasticity burns up calories more so than our muscles do. So a lot of them tend to be really thin, and they're given the medical diagnosis of failure to thrive. Some of them are fed through G-tubes in their stomachs, and so we've got a nutritionist who can help with that to optimize their weight. We've got a social worker to help families get children into school for the first time, transitioning them into young adulthood, and so those sorts of transition programs. They've got sibling programs here because it might be tough to be the brother of a kid who's in a wheelchair, and so to learn how to deal with those issues for the whole family. One of my old patients just started residency, went through med school, and so when you get to see those kinds of successes, that's my favorite part of my job.
Want to learn more about a topic presented on Champions of Care? The Oakwood Speakers Bureau brings health information directly to you at your workplace, community center, church, or school for free. Oakwood physicians and clinical experts present a wide range of interesting healthcare topics. From the lunchroom to the boardroom, Oakwood Speakers Bureau is your free health education resource. For more information, visit oakwood.org or call 313-586-4902.